Massachusetts has the best health care in the country. We do. Massachusetts, we have the best health care in the country. We have some of the best hospitals. Our scientists develop vaccines and medicines that save lives around the world. More people in Massachusetts get life-saving treatments, medications, and vaccines than any other state. People in Massachusetts are healthier than people in nearly every other state. And that's because we believe that health care is a right and public health is a responsibility. We built a strong public health system, as you can see from everybody standing alongside me here today. This is a strong public health system that's backed by science that gets people the health care that they need. Now, historically, we know the federal government has been a partner in this work. Unfortunately, that is not what is happening in Washington. Under the Trump administration, the CDC has been hijacked by people like Robert Kennedy, people who don't believe in science, and people who don't believe in science-based healthcare. As a result, the government is failing its responsibility to Americans, including Bay Staters. So we're here to say this is not going to happen in Massachusetts. In Massachusetts, we will not let Donald Trump or Robert Kennedy get in the way of patients and the care and the treatments and the medication that they want and need. So today I'm announcing several steps to make sure that that happens, to make sure that people get the medication and the vaccines that they want and need. So here's what we're doing. First of all, this is something that no state has yet done. Insurance plans in Massachusetts will continue to cover the vaccines recommended by the Massachusetts Department of Public Health, regardless of what any other federal agency or appointee says. This requirement has now been formalized in a joint bulletin issued by the State Division of Insurance and the Department of Public Health. It will cover the full range of recommended vaccines, including flu, COVID, as well as children's vaccines like measles, mumps, rubella, chickenpox, and more. As kids head back to school, and many of our kids headed back to school this week, we want to make sure that they can get the immunizations that they need to stay healthy, as well as our teachers and our families. Our insurance plans are here today. They are here today, supportive, and I want to thank them for their presence and for implementing this work as we move forward. I also want to thank MassHealth and GIC, which is the plan that covers many public employees, for taking the same step to make sure that people are covered. Bottom line, no one in the great state of Massachusetts is going to be denied because of cost. No one. Second, in Massachusetts, CVS, Walgreens, and other pharmacies will continue to schedule and give vaccines, including for the flu and COVID. Now, last Friday, Commissioner Goldstein, at my direction, issued a standing order that ensures that pharmacies can provide a COVID vaccine to anyone who wants it. Essentially, what this means, and the commissioner is a doctor, he wrote a prescription for every Massachusetts resident that covers everyone in this state. In addition, this morning DPH updated its policy so that the commissioner, and not the CDC, will determine which vaccines can be administered by pharmacists in Massachusetts. I want to be clear about this because I know there is concern. People have been calling pharmacies and not able to get appointments because of changes made by the Trump administration. That changes today, at least in Massachusetts. Because of what we're announcing today, starting tomorrow, pharmacists will be scheduling appointments and giving vaccines approved by the commissioner, and as I say, that's going to start tomorrow. All right, we were just finalizing it, but that's tomorrow. It goes into effect. Pharmacists will be scheduling appointments and administering vaccines approved by the commissioner. I'm grateful to CVS, to Walgreens, and our pharmacies for their communication and their collaboration to make sure this happened quickly over the past week. Third, moving forward, we will do whatever it takes to protect the health of people here and across the country. And that is why I'm announcing that we're forming a public health collaboration with states in New England and across the Northeast. We have been working on this for some time now. We will lead in the development of a few things. First, recommendations for safe, science-backed vaccines that patients, doctors, pharmacists, and health plans can rely on. Second, we'll work to protect and sustain our public health labs, our disease monitoring, our surveillance, and our emergency preparedness. We'll have more to say about this shortly as we move forward, but rest assured, wherever the federal government has created a devastating and harmful gap, we will look to do everything we can to protect the public health of residents in Massachusetts and work with our sister states to stand up and fight for and protect the public health of Americans. People here will continue to get the care and the protection that they need. It's a pretty sad statement that we can no longer trust the federal government on this, but sadly, that's where we're at. We've already seen more than $1 million cut from critical immunization funding, the loss of funding for asthma prevention and education, restrictions on funding for substance use disorder, HIV prevention and treatment, threats and attempts to cut hundreds of millions of dollars more in public health funding, threats to roll back access to reproductive health care, and that's on top of all the cuts that have already been made to food, to health care, to housing, to medical research that are hurting children, hurting seniors, hurting families, hurting public health of Americans across this country. So Massachusetts, we're not going to let this stand. We are taking a stand. We are a healthcare leader, and we're not going to let the Trump administration or Robert Kennedy cost lives and take us down. When others fail to do their job, and that is what is happening right now in the federal government. And by the way, to anyone who supported Robert Kennedy in his nomination, what did you think was going to happen, folks? Okay? So to those who have the opportunity to stop this from happening, shame on you. And to Republicans or any other politician or anyone running for office out there, if you don't take this moment to step up and support public health, there is nothing more core that we do in government than to look out for the health, the safety, the well-being of our residents, our communities, our states. You saw the testimony this morning from our purported United States Secretary of Health and Human Services. It's despicable, it's shameful, it's not right. But I am proud to be governor of a state with great healthcare leaders and a state that's always valued investments, not just in healthcare, but in public health. Because I believe as governor that public health is a responsibility. I'd now like to invite up Commissioner Goldstein. I want to thank Commissioner Goldstein as well as DPH Chief of Staff Emily Daly for the incredible work that they did alongside Gabe Viator, my senior advisor, in making sure that we had a right and ready response to the dereliction of duty by Secretary Kennedy and the federal administration.
Good afternoon, everyone. I want to start by thanking Governor Healey for her bold leadership at what has turned out to be an incredibly difficult and complex time for public health, a moment when public health is being undermined by partisanship and by ideology. Despite the headwinds that we face, Massachusetts is charting a different course, one that's rooted in science, evidence, and a deeply held responsibility to protect the health and safety of our residents and communities. I'm speaking to you today as the Commissioner of Public Health for this state. I'm also speaking as an infectious disease physician who continues to care for patients. I speak to you as someone who spent 2 years during the COVID pandemic at CDC. And there, I worked alongside some of the brightest, most dedicated scientific minds in this nation. People who devoted their careers to saving lives and preventing disease. Last week, sadly, some of those most highly regarded CDC leaders resigned from their roles. They were compelled to leave by political pressure and attacks on their integrity. These are leaders who could not and would not compromise science for ideology. Their resignations were not quiet departures. They were declarations. They were loud and clear and powerful. And they said that science must guide public health. Their departure comes after months of resignations, forced firings, and leaves at the department. The people who are no longer at CDC are exactly the individuals we should want making public health decisions in the best interest of this country. They're the people who have earned and deserve our trust. They are heroes. And here in Massachusetts, that same commitment to science that these dedicated leaders represent is what we'll fight for and what we'll preserve. I say this all the time, but vaccines are the greatest public health advance of our time. They prevent illness, they prevent suffering, they prevent death. To restrict access to vaccines is reckless. To play politics with vaccines is dangerous. And our state will not bend to the partisan decisions made in Washington that are putting our communities at risk. That's why today the Department of Public Health stands shoulder to shoulder with the Division of Insurance, requiring that insurers in Massachusetts cover vaccines recommended by DPH, even if federal recommendations place troubling restrictions on vaccine access. People in Massachusetts will continue to have the ability to get these life-saving vaccines no matter what happens at the federal level. We also want vaccine access to be easy and to be readily available. We all remember the power of our pharmacists during the COVID-19 pandemic. Hundreds of millions of doses of vaccine were administered across the nation because pharmacists were trusted, accessible, and ready to step up to do what was necessary to turn back the viral enemy. Last week, I was honored and I was humbled to issue a standing order that empowered all qualified pharmacy personnel in Massachusetts to dispense and administer COVID-19 vaccines to all eligible individuals in the state. Today, we can reaffirm our commitment to pharmacists as essential partners in protecting lives. They deserve that trust, and our residents deserved that access. We're anticipating additional action at the federal level. CDC is convening its advisory committee in the middle of September, and they've signaled that they'll announce vaccine recommendations at that time. While we hope that their process will utilize a thorough review of the safety and effectiveness of vaccines, DPH is prepared to move quickly to provide clear communication, reduce confusion, and maintain access to these vital protections. By the end of this month, we'll issue updated guidance, along with our colleagues across the Northeast, for the 2025-2026 respiratory illness season. The guidance will center the data. It will be in alignment with the recommendations of trusted professionals, and most importantly, it will be driven not by partisan ideology and not by firmly held false beliefs. Massachusetts will not retreat from science. We will not retreat from the evidence and the data and the technology that have demonstrated the life-saving value of vaccines again and again, and will not retreat from our responsibility to protect public health. Because here we believe that protecting public health is not optional. It's a covenant with every child, every parent, every grandparent, every resident of our state. It's a promise that we fully intend to uphold. Thank you, and I will pass it back to the governor.
Thank you. Thanks so much, Commissioner, and thank you for your service. You heard his resume, right? That's who you want in charge of public health, okay? That's who you have in Massachusetts. And I'm glad about that. And I'm glad we're able to take these actions today. And again, I want to thank all the partners up here. And it really reflects all the partners, all the stakeholders. This is as broad an array as you'll ever see when it comes to healthcare in Massachusetts or anywhere in the country. And I think it says something about our collective commitment to making sure that people have access to the care that they need, including the treatments they need, including the vaccines that they need and want.